Three cases of HMPV virus have been reported in the country so far, with 2 cases being reported in Bengaluru, where a 3-month-old baby has been discharged and an 8-month-old baby still recovering in the hospital. Meanwhile, a 2-month-old infant in Ahmedabad has also been diagnosed with the virus. This marks the first few reported cases of HMPV in India. Now, there is a lot of buzz, a lot of talk around it. People are getting worried. Can this, in fact, go on to become the next COVID-type virus? So let's just try and dispel and for your better understanding, try and put out facts before any kind of, there is public, people get worried about it or there is panic. Let's just first understand what is HMPV. Now, this is the Human Metapneumovirus, a respiratory virus. It has mild to moderate flu-like symptoms, prevalent during the winter, and is transmitted through direct contact. Most people recover with rest and hydration like you do with any flu. Incubation period usually is between 3 to 6 days. Who are most at risk? The vulnerable, young children, elderly at most risk as far as this virus is concerned, individuals with compromised immune systems. Children under the age of 5 particularly are vulnerable as far as this virus is concerned. What are the symptoms? If you are watching this and there is somebody around you, so what are the symptoms as far as this virus is concerned? Runny nose, cough, nasal congestion, sore throat. So most of these are, viral infection, flu-like symptoms. Fever in some cases. Some severe symptoms could also be wheezing, difficulty in breathing, hoarseness, pneumonia, an aggravation of asthma-like symptoms in adults. Now, just to recap, where are we as far as this virus is concerned in India? So far, there are 3 cases which have been reported in India. 2 infants from Bengaluru, one has been discharged, the other is recovering, and 1 infant from Ahmedabad. Let me also underline this, ladies and gentlemen, though, of course, people need to be careful, but there is no immediate panic as far as this is concerned, because so far there hasn't been any casualty or, extreme cases which have resulted in death as far as this virus is concerned. Now, what has the government said on this? The ICMR has said that there is no need to worry or panic at this moment. The virus is in circulation for a long time. So this is not something which is new, which is taking place. India is prepared to tackle this virus, and no unusual surge in respiratory illnesses which has been reported, at least at this moment. So let me first, in fact, take you to Karnataka, where my colleague Nehal caught up with the health minister. We also spoke to the health minister of Gujarat to try and understand what they are doing after these cases have been reported in both these states.
Are you going to announce any special measures?
No, there will be no special measures, because everything is, right now, nothing untoward is being seen, and there's no sudden surge of cases or hotspots or any serious situation that has emerged. This is an existing virus, and we are on top of things. We are in touch with Government of India, they are in touch with us, and it is being monitored. So let us not create any panic over this.
But mostly children are getting affected.
That is normally this virus affects children more and aged people more, because people with less immunity, it affects them more. But both the children who have been affected, one has already been discharged, one is going to be discharged, nothing to be worried about. And this is a very normal thing. This virus is an existing virus, it has never caused any serious problems so far. And I don't think we should start worrying too much about it, as of now, right now. Yeah.
Thank you. So the Karnataka Health Minister, after holding meeting with top officials here at Arogya Sadha, the Health Directorate has decided not to issue any special guidelines to check this virus, because there is no cluster has been found here. There is no surge at all, and that is why the health minister said there is no need for panic for the general public. All measures are in place. Only they have to keep themselves warm, and those who have poor immunity, they can be attacked by this virus, so they have to be more careful. With camera person Govind Murthy, Nihal Kidwai for NDTV.
2 मास का बच्चा जो डूंगरपुर राजस्थान से आया था सारवार के लिए, उसमें ये डिटेक्ट हुआ है और उसको सारवार के अर्थे अहमदाबाद भेजा गया है। जो गाइडलाइन है क्या क्या करना है क्या क्या नहीं करना है, वो राज्य सरकार की ओर से ये SOP भी जारी होगी। इसमें कोई पैनिक होने की अभी जरूरत नहीं लगती है, क्योंकि यहाँ से अपने जो केंद्रीय संस्था है उसकी तरफ से अभी कोई एडवाइजरी जारी नहीं की है, लेकिन उस पे सावचेती बरतने की वो वहाँ से सूचना दी गई है। इस हिसाब से राज्य
to the Union Health Minister JP Nadda, who is speaking on the HMPV virus. Listen in.
जो हवा के जरिए सांस लेते समय एक दूसरे में फैलता है, यह सभी आयु वर्ग के लोगों में संक्रमण का कारण भी बनता है। यह विशेष रूप से सर्दी और बसंत के मौसम के शुरुआती महीनों में अधिक देखा जाता है। चीन में जो HMPV वायरस के मामले पर हाल ही में आई रिपोर्ट्स पर स्वास्थ्य मंत्रालय ने इंडियन काउंसिल फॉर मेडिकल रिसर्च के साथ और नेशनल सेंटर फॉर डिजीज कंट्रोल के साथ और वर्ल्ड हेल्थ ऑर्गेनाइजेशन के साथ चीन सहित पड़ोसी देशों में स्थिति पर कड़ी निगरानी रखे हुए है। WHO ने भी स्थिति का संज्ञान लिया है और जल्द ही वो भी अपनी रिपोर्ट साझा करेंगे हमसे। ICMR इंडियन काउंसिल फॉर मेडिकल रिसर्च और इंटीग्रेटेड डिजीज सर्विलेंस प्रोग्राम IDSP के साथ उपलब्ध सांस संबंधित वायरस के देशव्यापी डेटा को भी समीक्षा की जा रही है और भारत में किसी भी कॉमन रेस्पिरेटरी वायरल पैथोजन में किसी भी प्रकार की वृद्धि नहीं देखी गई है। में जॉइंट मॉनिटरिंग ग्रुप की बैठक 4 जनवरी को आयोजित की गई थी और स्थिति का जायजा लिया गया है। देश के हेल्थ सिस्टम्स और सर्विलेंस नेटवर्क्स किसी भी उभरते हुए हेल्थ चैलेंज के प्रति क्विक रिस्पांस देने के लिए सक्षम है और तैयार है। हम स्थिति का क्लोज मॉनिटरिंग कर रहे हैं, हम स्थिति का बहुत नज़दीकी से जायजा ले रहे हैं और हम ये कह सकते हैं कि हमें चिंता का कोई कारण नहीं होना चाहिए। स्वास्थ्य विभाग इन सारी बातों पर नज़र रखे हुए है।
That was Union Health Minister JP Nadda speaking, and once again underlining that there is no unusual surge in the respiratory illnesses and there is no need to panic at this moment. Let's go across, in fact, at this in this segment to our guests, those who are joining us. Dr. Nihar Parikh, Pediatrician, Director, Chairs Child Care, is with us this evening. We also have Dr. Rajiv Jayadevan, Vice Chairman, Research Cell, IMA Kerala State. Gentlemen, thank you for speaking to us. Let me start by asking you, Dr. Parikh, because 3 of the cases which have been reported in India are all infants, very young children under the age of 1 year old. Does that mean that this virus is, specifically targeting, or children are much more vulnerable?
Hi. The first thing I would like to say is that children per se and elderly people are always more vulnerable to all sicknesses and viruses. It's probably because every child, as he or she develops an immunity either naturally through exposure step by step to multiple viruses, different strains with every passing season, and or through immunization. Now, this is not a new virus. Now, if it would have been a concern if it was a new virus, because no child would have had a prior exposure. But HMPV virus is a known virus, been there for years on end. We see it every winter season with the cough and cold season. And most of the children above the age of 2 and 3 have developed or have been exposed to this virus in their previous months or a year and have immunity against it. And the basic norm that there is no vaccine against this virus also means that this virus is not scary at all. So yes, children are prone to HMPV more, but children are prone to all viruses because their immunity is still developing.
Okay. Dr. Jayadevan, let me understand then this. A lot of people are comparing this. Are we looking at a COVID kind of a situation? Are we standing at the pre-COVID spectrum at this moment? Is there any degree of worry or any fair comparison between COVID and HMP virus?
There is no comparison at all. COVID is an all-new disease caused by an all-new virus. for which mankind had no exposure, history, or immune response. As Dr. Parikh said, the metapneumovirus, or HMPV, is universally seen in children, and most children get exposed to it by the age of 3 or 4. If you see studies across the world, you can see 90 to 100% of children have already had the infection. So we are talking about two completely different entities here. But for the general public, any virus that purportedly has links with China and is linked with scary visuals that are circulating in WhatsApp, they tend to believe what they see on their phone screens, and this shows the destructive power of social media, what the panic reaction we're seeing here. I'm getting so many calls from all sorts of people saying what's going on. This is a common expected viral infection in healthy children. There is no need for any concern at all. In fact, several of the health ministers who spoke before us said the same thing.
Right.
But the panic is unprecedented. So it is something that we must carefully address and use terms that will allay the anxiety of the public.
Absolutely.
As the doctor said, there is really no vaccine for this because it's such a mild infection.
Right.
You know, as children, most children get a few runny noses every year, and we don't go around checking which virus is causing a runny nose. If we did, yes, we would be finding lots of human metapneumovirus, but that doesn't mean the end of the world. So I think we must clearly understand the difference. This is not COVID.
This is not new, this is not COVID, and like you said, the endeavor, at least here at NDTV, is to try and allay those fears, try and calm those nerves, because there's a lot of information, misinformation, which is doing the rounds on social media. So, Dr. Jayadevan, let me again ask you this. It is not, you're saying it is not, there is zero comparison between COVID and this. This is something which is already been known, not something that you need to run and, take any injection or any, vaccination for. It's just a virus running its course. It's only social media which has made it that big and scary?
Yes, indeed. Indeed. The people are being presented with confusing visuals purportedly from China, showing crowded hospitals with people standing in masks and IV drips and so on. But I would like our viewers to know this is common in China every winter season. It's been well documented. China is going through a severe winter, and most people with a mild respiratory illness like a common cold will rush to larger hospitals. These are documented facts. So while the visuals are true, the narrative is wrong. So it's very easy to confuse the public by taking a picture and putting the wrong story behind it. And that's clearly what happened here.
Right. Okay. So you're saying there is nothing to worry about. But Dr. Parikh, for a lot, I'm sure you must be getting a lot of panic calls from parents as well. What can we do? What should we feed our children at this moment? Is there a way to protect them? So on and so forth. What would you like to tell those parents, those who have young kids at this moment?
First and foremost is to tell them not to panic, because when the parents are in a panic-stricken condition, they tend to look at symptoms even if they don't exist. They get worried way before they need to get worried. This is a virus that's, if your child has been through it or is going to get it, he's going to get a simple fever for a few days, along with cough and cold, and some unfortunate children may get a lower respiratory tract infection. But that's how every winter virus is. So the red flags are the same. Keep your children away from anyone sick. Let them resume. No masking as of now is required. Everyone, common sense should prevail. If you are sick, if your child is sick, please don't send them to public places where they can infect other children and other people. And you're still okay not to see a doctor for up to 2 days, even though your child is cough and cold, because we are going to follow norms of a regular viral. So treat at home. All the parents are very well experienced. They can manage fevers, cough and colds for 2 days. There is no need to flood our OPDs or emergency wards of hospitals. That will create an unnecessary chaos, over testing and over diagnosis, which is also a major problem because the virus is not severe at all. So once you're done with 2 days of fever, be normal, be calm, be patient, approach your pediatrician or your family doctor, and they will guide you through.
Okay, in the end, just to conclude, thank you so much. I mean, I'm sure it is reassuring for a lot of parents, as it is for us. I mean, we were also throughout the day trying to put this message out, but it always works better when experts speak. In conclusion, Dr. Jayadevan, let me understand this. Is there a need for wearing a mask at this moment, or getting in some sort of a test at this moment, or should we just let it be?
no more than you would on another normal day. That's my answer to the question.
So there is
If,
no
for
need.
example,
Absolutely.
someone who's received an organ transplant, they would wear a mask. And if you walk into a crowded outpatient, yes, you're better off wearing a mask than without. So, it's like that. Based on this particular news, there is no need for anyone to start wearing masks based on this particular news alone. As the doctor said, yes, if you have a child who's having a respiratory illness, don't let the child mingle with other people, and try not to attend social gatherings where people are coughing and sneezing around. And this is universal precautions. That's got nothing to do with HMPV.
So it's business as usual, ladies and gentlemen. Don't get bothered. Don't get worried about it. The good doctors are telling us that you can carry on with their lives as it was usual. This is not a new virus. It usually happens, sorts itself out on its own. If there is any problem after a couple of days, you can contact your family doctor or your pediatrician and try and get their advice on how to go about it. It's just another viral flu infection that usually people go through in winters. Gentlemen, thank you so much for giving us your time and explaining this so candidly to our viewers. So don't rush for those N95s. Don't rush at this moment to the OPDs to try and find out something which at this moment is not worrisome at all.